This is a video for the correct use of personal protective equipment for a Scenario 0 clinical area. On this ward, in addition to normal clinical uniform, a fluid-resistant surgical face mask is to be worn at all times. Apron and gloves are to be worn for and changed after each clinical encounter. Before entering the ward, hand hygiene is essential with alcohol gel and soap and water. The face mask must be taken off on exiting the ward after splash contact or when it has become moist. Donning instructions. Please complete the following in the designated donning area. Put on a fluid-resistant surgical face mask, ensuring it is closely fitting and fully covers the mouth and nose. First, position the upper straps on the crown of your head above the ears and the lower straps around the nape of your neck. For masks with elastic straps, hook the straps around your ears. Ensure the mask is flat against your cheeks. With both hands, mould the nosepiece over the nose by pressing down both sides of the nose until you have a good facial fit. When delivering clinical care for each patient, a plastic apron and gloves must be worn. A new set of apron and gloves must be worn for each patient with appropriate hand hygiene used. It is likely that patients in Scenario 0 areas will develop symptoms which mean they have suspected COVID-19. In these cases, the patient should be isolated in a side room, making it a Scenario 1 zone, and Scenario 1 PPE should be worn when delivering patient care in this zone. For patients isolated in a Scenario 0 ward, before entering the bay, please ensure that you have reviewed all the relevant clinical records for each patient in the bay, as you will not be able to take any documentation, patient lists or computer equipment into the bay or side room. Put on a plastic apron, eye protection, hair protection and gloves, in addition to your surgical mask. Enter the isolation room. Please ensure a safe distance is kept from the patient's face at all times. The end of the bed is a good measure of the appropriate distance. Ensure you have any equipment you require to hand or located in the bay and that a regular cleaning schedule is in force. Treat any equipment as contaminated unless you personally have witnessed it being cleaned appropriately. Do not spend any more time than is necessary in the high risk zone, equivalent to 1 metre of the patient's face. Ensure the patient is looking away from you at all times if you are within 1 metre of their face. After patient contact in an isolation room. Following each patient examination or care, whilst inside the isolation room, remove gloves and use alcohol gel to decontaminate your hands, or wash hands up to the elbows if there has been skin contact. Remove apron and perform hand hygiene. Leave the isolation room. In the designated doffing area outside the isolation room, remove hair protection, for example your theatre cap, by pulling backwards and perform hand hygiene. Remove eye protection. Remember, outside of the goggles or face shield are contaminated and should not be touched. Dispose of the eye protection if it is disposable. If not, either pass the eye protection to a clean assistant wearing gloves, or if no clean assistant is available, place the eye protection on a surface on top of a Clinell wipe. Use alcohol gel to decontaminate your hands. If you are wearing glasses, follow the same procedure. Remove your surgical face mask. Wash your hands using the alcohol gel. Put on a new surgical face mask using the same procedure as described for donning a surgical mask. Perform hand hygiene and return to the normal clinical area. Leaving the Scenario 0 clinical area. Please complete the following in the designated doffing area. Once you are ready to leave a Scenario 0 ward or clinical area, perform hand hygiene, remove the surgical face mask, and perform hand hygiene one final time before leaving the ward.